we've got Lulu Becker with us. She's a pelvic physio from Luluphysio, and she runs a women's health clinic. Pelvic health, mindfulness, women's and sexual wellness. So you're an educator. You've also got your own podcast, I'm Not in the Mood. Amazing. Welcome and thank you for joining us today.
Thank you so much for having me. I'm so happy to be here.
So we're going to start with the first question, which was basically just to give us a bit of an introduction and let us know how you started with everything.
Okay. So I studied physio, and in our physio degree, we had one lecture on what pelvic and women's health was. And I think it was about a 2-hour session where this lady arrived and she had a set of vaginal weights. And we were like, who on earth would ever be a physio that specializes in this part of the body? I think at that time we were all still dreaming of being like the next Springback physio. So it was definitely not something that I ever thought I would go in. And after I did my community service year back where I'm from in Kokstad, I grew up on a farm in Kokstad. I moved to London, as many of us did in those days, where it was easy to get visas, and moved to the UK, and we had lovely locum jobs that we could go and do there. And it was while I was in the UK that I almost fell into this world of pelvic and women's health, and I'm so grateful I did, because it has just enriched my life in the most beautiful way. But I wanted a job working with children. And the hospital that was interviewing me said, we've only got a post that is half women's health and half pediatrics. I said to them, well, look, I've had the 1 2-hour lecture at Varsity. Like, I really don't know what's going on in pelvic and women's health. But I had the most wonderful mentor who had been, she's a Swedish lady who'd been working there for years and years. And they said, well, if you're happy to take the job, she will help and mentor you. And she's been one of the biggest blessings in my life, who just helped guide me on true biopsychosocial care, psychologically informed physio, understanding the whole person and not just the body part. After 12 years in London, my husband and I moved back to KZN with our girls, who were then 2.5 and 4 months old. And when we moved back, we were in Luluphysio in Durban, we're now in Salt Rock. But when we moved back to Luluphysio, all my physio friends said to me, you're not going to be able to just have a practice that does women's health. There's not enough work. And I said, well, guys, I've actually got no option, because it's been 10 years since I've seen an ankle or a neck or a knee. Like, I actually don't know what to do with anything like that. And yeah, it turns out there was a huge need. And so very quickly, I was very lucky to have a very busy practice. And then for the last 5 years, I've been teaching other physios who would like to move into this area of women's health. Women's health physio, pelvic physio. I am fascinated by how the mind impacts on the body, how our body can hold and feel emotions and trauma, and how so much wisdom is held within us if we are able to just slow down and spend some time and attention being with our bodies. So I did a postgrad with Amisa and Stellenbosch in mindfulness. That was a absolutely life-changing 2-year course. And then last year I qualified as a sex counselor, which I feel absolutely married my 2 passions of pelvic health physio and mindfulness together so well. Because I feel we have a huge problem, not just in South Africa, but worldwide, as we become more disconnected from our bodies and less in touch with our sexuality, sensuality, and how we really can make such a big difference in our lives just by slowing down and being a bit more compassionate in different areas.
Fantastic. So that actually touches on the second question, which was, what are your main focus areas as pelvic floor physio and women's health educator? So that's amazing. Can you tell us a bit about what you're discovering in terms of the link between our menstrual cycle and pelvic floor health?
So I think when we are thinking of the pelvic floor, I think maybe it's easier if we just think of it as like the whole area around the pelvis. So in terms of not just these muscles of the pelvic bowl, but it's also what's happening around the tissues and all the different organs within the pelvis. And when it comes to the menstrual cycle, I think the first thing that would come to mind with that question is around our ladies with endometriosis. So we know that our ladies who are battling with endo to have the most awful, debilitating periods and pain with it. And with that pain and discomfort, very often comes that tension and tightness in the pelvic floor. Because as much as the Cosmo magazine told us forever that we just need to Kegel and strengthen, The pelvic floor needs to be able to fully contract, yes, absolutely, so that we can be continent, but almost more importantly, it needs to be able to fully relax. And our ladies who struggle with letting go or softening or relaxing their pelvic floors very often struggle more during their periods too. Many ladies with a tight pelvic floor aren't able to use a tampon, and it's very seldom that we find there's only discomfort or dysfunction in one area in the pelvis. Normally they're like all grumpy neighbors tucked in here together. Normally there's quite a bit of overlap happening between everything. It's absolutely all interconnected. Yeah.
So now, actually, you've basically opened the door with this. So how does sex tie in with pelvic floor? Very much, obviously.
Absolutely. It's everything. Yeah. So as we said, the pelvic floor, it's very important that it's able to contract and to lift up, because that's what helps to keep us continent of urine and of feces. But also very importantly, it needs to be able to fully relax. And why it needs to fully relax is so that you can do a wee, that you can go and do a poo, but also so that your pelvic floor muscles are able to relax so that you can have penetration, but also not just for penetration, but for orgasm. What happens during a female orgasm is the pelvic floor needs to move through its full available range, which is why you get those like little shudders like that happen with an orgasm as the pelvic floor contracts and relaxes. And so it makes sense then, if somebody's got a lot of tension in their pelvic floor, if these muscles are all really tight and holding on, then it's far more difficult to tolerate penetration more easily. Not that penetration is the only way to have sex, but if penetration is your goal, then it's way more difficult if these muscles are tight. But also, to achieve an orgasm is more difficult if the pelvic floor is already holding all the way up here. It needs to be able to fully relax so that you can experience adequate pleasure during intimacy too.
Okay, great. I wanted to touch on the biggest... Yes.
I'm sorry, I just want to say one more thing on the other most common reason we see in terms of discomfort with intimacy. As we were saying, the one is if the pelvic floor muscles are holding a lot of tension, but the other one is around the actual tissues of the walls of the vagina here and externally around the vulva. And that is something that is very linked to what's happening with our hormones, especially estrogen. Okay, so one of estrogen's biggest jobs is to provide lubrication around the tissues, both day to day, but also when we have increased arousal, so that it's easier for intimacy. And the two times in our life where we most frequently see very low estrogen is when we're breastfeeding. So for prolactin to be there for us to make milk, we can't have estrogen. So anyone who's watching this who is breastfeeding and you're finding you're just more dry and that intimacy is feeling quite stingy or burny there, it might be that you are low in localized estrogen. And for that, you can speak to your doctor and get some estrogen cream that's a very low dose that you are usually allowed to have when you're breastfeeding, because that just helps to increase the blood supply there and can be an absolute game changer if the discomfort you are feeling is more at the entrance and it's like stingy, burny. Other time we obviously have lower estrogen is around perimenopause and menopause. And for a very long time, there have been some very scary warning labels on the topical estrogen cream. And in about November last year, the FDA in the States actually removed all those scary warning labels, and it's been so wonderful for women. It has meant that a lot of our favorite creams are now out of stock, especially here in South Africa, but there are some other versions. You can get it over the counter. Go and speak to your pharmacist. We need more ladies aware of how wonderful using just localized vaginal estrogen, how life-changing it can be. And even ladies who've had estrogen-positive breast cancer, speak to your oncologist. It's such low absorption and it's so localized that generally it's safe to be used even by ladies who've had a history of cancer.
That's such great news. Yeah. Sorry, I wanted to touch on some of the biggest misconceptions that you found with pelvic floor.
Yeah. So I'd say probably number one, all you need to do is Kegel. All you need to do is strengthen. And that the tighter the better. No, not the tighter the better. Because very often tighter means more uncomfortable for you. And I also feel like actually coming to that with myths. The other myth that men just want intimacy and penetration at all costs, and that men just want everything to just be tight, and that no matter what, a man just wants to be able to have sex and be done with it. I feel like none of the partners of the women that I see that are struggling with pain just want their partners to push through it. Men want their partners to feel pleasure and enjoyment too. And I feel like that's a huge myth I've come across, that men just want it at all costs. I think men get a far bigger thrill out of women enjoying intimacy than women get out of men enjoying intimacy.
It's
Yeah.
amazing.
Oh, so many myths. I feel like we could go for days. Other myths that you can leak urine if your pelvic floor is weak, yes, but you can also be leaking urine if your pelvic floor is overactive. Okay. Other things that we see is, and I think we're going to talk about constipation in a bit, but just I feel like constipation is probably the most underrated epidemic of our society, and constipation causes havoc on a pelvic floor because the weight of the stool sitting in the rectum is heavy, and so the pelvic floor tightens up even more. And if you're thinking about if you need to go and do a poo, you need these muscles at the bottom to be relaxing as the pressure in your stomach gently increases to be able to push to poo. And if these muscles are too tight at the bottom because they've had such a big lump of poo sitting there for a long time, then it can make us more likely to struggle with hemorrhoids and struggle with fissures. And we know for hormonal health, we know for 90% of our serotonin is made in our gut. Serotonin is the main hormone responsible for feelings of well-being and happiness. So the more constipated we are, the more we can struggle with mood and anxiety, especially in children. So many kids, we improve their constipation and the parents are like, oh my goodness, it feels like we've got a new child. Suddenly they are just feeling so much happier and easy going. Yeah, so I think constipation is hugely underrated. So if you aren't already, use a footstool and your poo should be looking like a nice soft banana and no breath hold.
Okay. Wow, that's so interesting. So I know you've already touched on the Endo Association. Is there anything more that you wanted to add to that?
We have a huge problem worldwide in that the average time to diagnosis for women with endo is between 8 and 10 years, and that can't continue. So I think the other thing we need to remember is that endo, we think there is a genetic component of it, but we need to remember that it's not only passed down from the mum's side, it can also come from the dad's side. So a friend who's a gynae says she sees two types of mums bringing teenagers to her. The one mom will say, I've had pain with periods my whole life and a diagnosis of endo. She cannot go through what I've been through. And the other mom who says, oh my goodness, I have never had a painful period in my life. I don't know what is going on with her. She's needing to miss school. She's so sore. She's having so many IBS type symptoms. And then it turns out that dad's sister or dad's granny or dad's mum had a history of endo. So painful periods are not normal, and if we've got to stop this thing of just expecting girls to push on and carry on, and if you suspect your child has endo, you suspect you have endo, please go and see a gynae who sees a lot of endo, because endo is also a speciality. So I normally say try and see one of the fertility gynaes because they tend to see the most endo. And we know the more quickly we can try and get on top of it with a treatment, the less time there is for these adhesions to be laid down in the pelvis. And actually, the more young girls we can get being helped with an endo diagnosis and then going on the pill or having the Mirena or having some kind of medication to help them, it should hopefully then help with fertility preservation later, especially with all of us having babies later. Yeah.
Exactly.
But to miss school, to miss work, that is not normal to be in so much pain from a period.
No, absolutely. It's so far reaching. It's one of the, it's just terrible. And I think there's still a lot of misunderstanding around it, a lot of sort of gray areas, which makes it so much harder to deal with.
And we also want to watch this thing of pushing, and this is where like the whole wellness influences, and I mean, I know you work in science too. So just there's been so much kind of misinformation that's been pushed on the internet around birth control and things like that. And look, every decision we make is going to have pros and cons, but we need to understand both of them. And I think a lot of us marked it on for a long time because of what we'd read in the wellness industry, myself included. I pushed through super heavy periods for a super long time because I didn't want any artificial hormones, to the point that all my hair was falling out. I was so anemic, and getting something like the Mirena has absolutely changed my life. So I think the pendulum needs to be somewhere in the middle, and we need to be empowered to know that there will be pros and cons to the decision we make, but that there is often a lovely medical option to be had alongside your lifestyle holistic changes too.
I wanted to talk about, now I don't know if I'm going to pronounce this correctly, but what is vaginismus?
Vaginismus.
No. Vaginismus.
Vaginismus. Okay.
Yes,
So
what is that?
vaginismus is a condition that happens in the pelvis where there is so much tension that happens at the entrance that ladies have never been able to have anything come into their vagina. So these are ladies who've never been able to use a tampon, they've never been able to put a finger there, and then understandably often very much battle with any kind of intimacy that involves penetration. So very often there has been a history of sexual trauma, not always, but often ladies who've had a history of sexual trauma, it's almost like the brain's safety mechanism of, I'm not safe, I'm not going to allow anything to come. And over the years, I've had a few ladies who have almost like developed a new vaginismus, which was, I thought, no, this is interesting. Why are you suddenly not able to? And it's turned out that their partners were cheating on them, or it was almost like there was some deep subconscious that their brain said, this is no longer safe for me to be able to have this penetration. So working with ladies with vaginismus, we always will make sure that that they're having adequate psychological support to medical help where possible. And what we need, or what we aim to try and do as physios with vaginismus, is we're trying to help the body and the tissues to know that it's safe for something to be coming here. And very often these ladies are very frustrated because they want to be intimate, they want to do things, and we just have to allow the body to guide us with what feels safe and appropriate in it. And then also we use, I can reach one over here, we will then teach ladies how to use dilators at home. So we have varying sizes of these little things. And then usually once my ladies are managing my finger okay internally and their finger internally, then I've got a whole lot of varying sizes of these over there, but then they practice using these at home just so their brain gets used to having something that is just of a bigger size there. And then we normally practice with moving it in and out until their brains feel safe, and it's just safely and gently introducing that kind of touch in that area. But it's also far more common than people realize. I've treated a number of ladies over the years who've been married 6 years, 7 years, 10 years, 12 years, who've never actually managed to have any penetration. And this is again why we need education, that there is help to be had, and that you're not broken,
Exactly.
you're not alone struggling with this. There are many, many ladies who struggle with this, and it's absolutely not your fault.
Yeah, absolutely. I wanted to go back to fertility and the link with pelvic health in that. Can we discuss that a bit more?
Yeah. So coming on to the one we've just said, of course, if you're unable to manage any penetration, then that's going to have an impact on you if you would like to be conceiving. And I get a few referrals a year from the gynecologist at our local fertility clinic where they'll say, we've scanned her, it looks like she's got great eggs, her bloods are all good, her semen analysis is great, but they are struggling with penetration. And I had 2 ladies last year within just a few times of them actually managing to have penetration, they were then able to conceive.
Oh, wonderful.
And then, it's the most rewarding work. And then back to what we were saying with endo. So we know endo can have a huge impact on fertility. And the other thing is, as we said, endo has a huge impact on the pelvic floor. If you are in a lot of pain, what your body should actually do is say, oh, that's really sore there. Why don't I relax that muscle and send a whole lot more blood flow? But we know that's not what happens. When we are sore, we tend to subconsciously tighten up even more. And not just with a history of pain, but any kind of anxiety actually ends up manifesting in these muscles of the pelvic floor. They've done studies where they got women to watch scary movies, and they put muscle readers on the shoulders and around the pelvic floor. And as the ladies got scared in the scary movies and the shoulders went up, the pelvic floor came up too. And I mean, I check in with myself where I'm like, oh my goodness, what are you doing? And I feel like I'm just subconsciously gripping my pelvic floor if there's something that I'm feeling worried about. So endo and the pelvic floor link. And then also just coming back to the more emotional and nervous system side. If you are struggling to conceive, that is going to have a huge impact on your entire nervous system and well-being. There's such a link also between how we're breathing and what's happening with our pelvic floor. So if you are feeling more overwhelmed and your nervous system is more sensitized, chances are you're going to be breathing more with your upper shoulders. And what should happen when we breathe in is our belly should rise, and when we breathe out, it should fall. Okay? So it should be as we inhale, belly rises, and as we exhale, belly falls. But in the majority of ladies we see coming to our women's health physio, when they breathe in, their belly sucks in, and when they breathe out, their belly pushes out. And the impact on that ends up happening around, then we think, blood flow around the abdomen. So anytime we can be optimizing that diaphragm movement, that belly movement, that pelvic floor movement, it would make sense in that we are just getting more blood flow to the ovaries and to the uterus, which can then be beneficial too in terms of trying to conceive.
Absolutely. And then how does that affect everything once you are actually pregnant?
So in
What
a
is the
perfect world,
impact?
so yeah, it can have a huge impact. So I'm going to say in a perfect world, everybody should ideally try and see a women's health physio while they are pregnant, which we know isn't always possible for everyone, but if possible, while pregnant. And then France is one of the only countries that gets women to routinely see pelvic floor physios postpartum. So the French have realized that they save more money later in life by encouraging ladies to have more physio earlier on. And I think
Yeah.
more and more here in South Africa, thanks to things like social media and more education, we are getting, I always say my favorite patient is 6 or 8 weeks postpartum and she's got zero pelvic floor symptoms, but she's just coming to see if she's had a Caesar, what's happening with her scar movement, what's happening with her pelvic floor, because as much as we might think if you have a Caesar, your pelvic floor hasn't been affected, it still carried a baby for 9 months. That's an exhausting amount of work on the pelvic floor. And then especially if your birth will go as planned, the body can hold on to that too, and we often find ladies are holding a huge amount of tension if they've had a stressful birth that ended up in a Caesar if that's not what they wanted. And so we love seeing ladies at 6 or 8 weeks to then see how the tummy muscles have come back together, how they're managing pressures through, if they are battling with any incontinence, and we're going to look at, is the pelvic floor holding too much tension? Is it too weak? Do they maybe have any kind of prolapse, so the tissue is moving a little bit into the vaginal canal more than we would like them to? So definitely postpartum, and then ideally during pregnancy too, we want to see, are you able to fully relax your pelvic floor? Are you able to contract it? And then for our ladies who are hoping for a vaginal birth, it can be really helpful to come for a birth prep session where we practice how to push and we help to release any tension that we might subconsciously be holding, especially around this area of the pelvic floor where we often find a lot of tension. And then we also help our ladies practice how to do their perineal massage. So there's lovely research for doing perineal massage before we give birth to help to minimize pelvic floor injury during birth too. And then obviously for any aches or pains you're having when you're pregnant. So what they say, back pain, common but not normal in pregnancy. I think most ladies feel some element of discomfort in their back. And also I say to my ladies, you're putting so much effort into growing this baby. It's so lovely if you can be receiving some touch and in return. Yeah. So I say to everyone, once a month, try and go for a treatment of something, massage, nails, something that's helping you to receive in a time that you're putting so much energy into creating.
No, you're right. So I can see obviously there's a lot of relevance in specific exercises to sort of assist in either strengthening those areas or releasing and relaxing and that. So that's really, really an important component.
Yeah, and I think if everyone can remember exactly that, it's not just about the strengthening all the time. It's really about the letting go too. And so if you are someone who battles with discomfort with intimacy, you've struggled with using a tampon, you just feel pain around your vulva or your tailbone at any point, you battle with constipation or you struggle with orgasm, then it might be that your pelvic floor might be holding more tension than we would like. And so it might be that to start, you would want to work on the softening and letting go. And the most beautiful way to do that is actually just with taking a big breath into your tummy. So if you put your hand on your belly and you take a big breath in and your belly rises, it actually, because of the way the pressures work, we've breathed in, diaphragm pushes down, that pelvic floor gets a lovely little stretch down, like that, by the belly rising. And also just checking in during the day. And am I sucking my stomach in? So many of us are subconsciously pulling our tummies in. And if you are sucking your stomach in, it's increasing the pressure in your abdomen, and then your pelvic floor doesn't want you to leak. So it's tightening up like that. So everybody we see who's tending to grip and hold their belly, very often their pelvic floors have to tighten in return.
Do you think there's a link between recurring UTIs? Is that an indicator of something happening with your pelvic floor?
So as I said earlier, I feel like it's very seldom that there's only one thing going on. There's often just these grumpy neighbors. We think the bladder sits right here, you've got the rectum sitting just behind it, we've got bladder there, we've got pelvic floor muscles, and there's so much crosstalk in terms of the innervation too that's happening there. I think the other thing we've got to be aware of with recurrent UTIs is it definitely a UTI? Is there definitely bacteria in the urine? Or is it that you're getting all the symptoms of a UTI, but actually it's bladder pain syndrome or interstitial cystitis, which is almost like a chronic pain that can develop in the bladder. And I tend to find my ladies with recurrent UTIs tend to have more overactive pelvic floor, so more tension in the pelvic floor. And if you, to be able to do a wee and a you need to be able to fully relax your pelvic floor. And so if you are not getting a good empty of your bladder, then you can be more prone to having UTIs. But also, if you have a prolapse, if your bladder has dipped a little bit into the top of your vaginal wall, then it can be more difficult to empty your bladder completely. And then that can also increase your risk of UTI.
Wow. Okay.
If you do battle with recurrent UTIs, I highly recommend anyone who does to try and see a pelvic and women's health physio. There's lots we can help with.
Amazing. I just wanted to check with you, are there any workshops or collabs or anything coming up that we can look out for?
I'm hoping to announce a few more soon. I have spent most of this year working on creating and teaching a course for other physios who want to work in the world of fertility. So that is where most of my energy has been this year, in creating and teaching this course. But I will hopefully have a few more workshops and things available soon. Desperate to put together some kind of course for anyone who's interested in this overlap between mindfulness and sexuality, because I think there's so much that we can benefit from there too. But yeah, nothing for now. I'm just finishing this course. Yeah.
Amazing. And your contact details, what are the easiest ways to get hold of you? I know
So
I was on.
yes, Instagram is probably the easiest. So it's just Luluphysio. And if anyone would like to email me or contact me, it's just lulu@luluphysio.
Amazing. Thank you so much for joining us today. It's been so insightful. There's actually so many things that I'm just thinking about now as I try and sort of process everything you've said. So crazy how everything is interconnected the way it is. Especially with women. I think we're quite complex. We're quite nothing sort of superficial level. There's a lot of things that are happening at the same time.
Absolutely. It's also intertwined. I feel like we could have spoken about each element for this longer. Thank you.
Absolutely.
Thank you
But
so much
thank you
for
so
having
much.
me.